Okay, that's pretty much it for prevention. I think it'll be pretty straightforward. Cleaning wounds. How do I clean a wound? You guys haven't had lab yet, huh?
Normal saline.
Okay, yeah, normal saline. It's on page 1200 at the very bottom of the page. So it says you rinse the wound with normal saline, and then you can lightly cover the area with the dressing.
I think it's injections this lab.
Yeah, this lab is injections still.
Really?
Yeah. Or like a behind.
Okay,
like
I feel
what
like
we've learned.
labs helped a lot on the test, especially
Yeah.
for this one because you guys will actually like clean wounds. Fake
We
wounds.
like discuss it and then like a week later we have the lab.
Yeah,
It seems like
that's
we're like really
weird.
delayed.
Yeah, that's weird. Okay, but normal saline is the preferred cleaning agent. You wouldn't ever use like hydrogen peroxide. There you go. Sorry. Okay. And then another way that we can clean wounds is a wet to dry dressing. But that's for like debriding cleaning. That's not just for like generally cleaning out the flora and bacteria. That's like getting rid of this stuff. Yeah, or like dried up necrotic tissue. So what you guys will do, and you'll do this in lab, you'll practice, but we'll just walk through it. So you have your wound. You have like a semi-sterile procedure. Like we're not gonna ever put just normal gauze inside of a wound. We're gonna open up a fresh package of sterile gauze because we don't wanna ever put anything that's not sterile in the wound. That's why when we measure, we use a sterile Q-tip, sterile gauze that goes in it, sterile saline, that kind of thing. So you're gonna wet it down with your sterile saline, and then you're gonna lightly pack it with wet gauze. You're gonna let it dry, and then once it dries, you rip that sucker out. And it is painful. So
Yeah.
always give a pain med before, like an hour before. If it's a PO med, hour before, IV, half hour before.
So that's the same like is that packing
Mm-hmm.
like that comes in the bottle and
Yeah.
it's just like that big old string of
Mhm.
stuff and they shove it in there.
Yeah, that's for like small wounds. My mom had a cyst drained, and she had some stuff removed out of her breast, and they packed it up in with that string. But for like a bigger wound, you're probably just gonna open up a pack of like sterile 4x4s or something, and kind of wet them down and put them in. So, but if the wound does not have any of this stuff in it, you would never do a wet to dry. Because you're going to take out that granulating, fresh baby tissue, and that's not what we want. We only want to do debridement when there's this stuff. Okay? So usually, if it's like a good, clean wound, but you just want to rinse it out to make sure you get all the bacteria maybe that could be growing, normal saline, you just rinse it out. You get a syringe and rinse it out. But for like really bad wounds that have that stuff, you would debride it by doing a wet to dry. Debriding, it's
But we would never do that unless we were trained to, right?
exactly
I would not want to be a wound care nurse.
debridement.
Personally.
Yeah, that's the thing about tests is because I feel like sometimes I'm like, well, I wouldn't do that because I'm not a wounds care specialist, but they still test you on it so you understand the process.
process.
Yeah, but you're right. Debriding is for like wound care specialists, so whatever. Okay, wound culture. Kind of the same thing as measuring with a Q-tip, only you're going to roll the Q-tip around in the wound. So it's on page 1191. Yeah, but this is the thing. Before you take your sterile Q-tip and like rub it around, you want to clean the wound first with normal saline. Why do you think I'd want to rinse out the wound before I took my culture?
You don't
There
want
could be
anything.
other bacteria
Yeah.
that's not even part of it.
So it says we want to remove the skin flora, so like the natural bacteria that kind of is present on our surface, our skin surface, because aerobic organisms can grow in like an open wound. So we want to make sure we get that stuff off, and then we would know exactly what's growing in the wound. So just always clean the wound with normal saline first before you do a wound culture. Even if it's like a tissue, like you can, and I've watched this, it's so gross. I had a patient who had a wound, pressure sore on her bum, and then she started growing these like things, like I don't know, it was like so gross. And they came in and like cut some of those off to go test them, to see what they were. And so wound culture too. But if you do a wound culture like where they go in and cut tissue out, you still rinse it with normal saline first. So either way, either type of culture.
So
they
would that
could
be
do.
called a biopsy?
Yeah,
more?
tissue biopsy more. Which I don't know that they'll test you on that, but it's in the book, so.
So they like numb her first, or did that she feel it?
No, she was a paraplegic. She didn't feel
Oh.
anything. So I don't see. That's the thing. I don't know what they would do on a normal patient. They might do some lidocaine or something at the area.
That would have hurt.
Yeah, that would be painful. But she didn't feel anything, and he was just snipping. Yeah, and she was bleeding like everywhere, and it was like it was really bad. That was when I was kind of like new, and so I was like, oh my gosh, so gross. So, okay, so dressing wounds. Why do we dress wounds?
Help prevent infection.
Yeah, so it protects, it absorbs really oozy wounds. This is on page 1201. So just a couple things. It says it protects the wound, it aids in healing, supports the wound site, it protects the patient from seeing the wound because patients can be very damaged by that, their self-esteem, because it can provide a moist environment because moist things heal a little better. I mean, we don't want it too moist, but we don't want it dry. We want it just a little bit moist.